Hi everyone, I'm Dr. Domingo and welcome again to my vlog. So it is still Women's Month, so today I'm going to talk about cervical cancer. So on the African continent, cervical and breast cancer are the top two cancers in women. So what is cancer? So cancer is a growth of overgrowth of abnormal cells. So you get the harmless ones that are the benign cancers, and you get the malignant ones, which are the harmless ones which spread and cause a lot of damage. So cervical cancer is the overgrowth of abnormal cells on the cervix. The cervix is the junction between the womb and the vagina. So just to remind ourselves what that looks like, I've got a picture here. So this is the womb, that's the vagina, and this is the cervix, which is between the womb and the vagina. So the most common cause of cervical cancer is the HPV virus. It's estimated that HPV causes 91% of all cervical cancers. So HPV, the human papilloma virus, is a sexually transmitted infection. And it is estimated that about 80% of all females who are sexually active have HPV in their teens and early 20s. So when it comes to symptoms, there are no symptoms that indicate that you have cervical cancer. That's the tricky part. But the good thing is we pick it up with pap smears, and this is why pap smears are so important, regular pap smears. It's the only way to pick up if there are any abnormalities, to pick it up early enough. So the cancer goes through a pre-malignant stage where you see these growth of abnormal cells. And that's why pap smear is so important, because if it gets picked up early, it can be managed. Unfortunately, a lot of the cases of cervical cancers that have spread, it's usually in people who have never had pap smears before. And that is something that's completely preventable. I've seen young women in their 30s who die from cervical cancer, and I mean, there's no reason for that to have to happen. So who needs to get pap smears? Any woman that is sexually active, because once you become sexually active, you are at risk of contracting HPV. There is a vaccine, Gardasil, that prevents majority of the higher risk HPV strands. And this vaccine is available to men and women from the ages of 9 to 45. So for men, they can carry the virus around, and that's why it's good for them to get the vaccine as well. So yeah, that's basically it in a nutshell. So the take-home points today: cervical cancer can be picked up early and it can be treated. It can be prevented with the HPV, the Gardasil vaccine. And the only way to monitor and make sure that you don't get it is to get regular pap smears. Thank you for listening. Today was a short one. Please share this video with your friends and your family, and subscribe to my YouTube channel and follow my Instagram and Facebook page. And feel free to comment, ask me any questions, and thank you for watching.